Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a research and presentation series or edition, and this audio podcast is part of a Storm Labostics production. Today, there'll be today in this sort of overview, there will be a look at healthcare scientists, healthcare services, and laboratory investigations, and looking at summarizing poll data summarizing poll data from looking at works from peer reviewed and published from 2020, and wherein this presentation, the ZtormLabostix Collaborative, will look at the publication from an adaptive perspective. So to begin with, I look at the contents. So introduction, I look at an introduction, look at healthcare and drivers for change. I look at aims and objectives. I look at a literature review. I look at sort of a methodology. I look at sort of continuing looking at polls or poll data and implementation, looking at analysis, looking at implications to practice, discussion, conclusion, and then the reference or citation. So now, a look at an introduction. So, patient access to information support to supplement understanding of laboratory investigations, and laboratory reference markers faces challenges owing to medical or clinical and medical and scientific terminology or terminologies. At the same time, such terminology is everyday language for healthcare professionals communicating with each other. But when healthcare professionals communicate with patients, the medical terminology can become overwhelming. Concerns give rise or can give rise to provision of advice, information, and education around several aspects of health and disease. However, in addition, there has been a rise in support groups are online and through social media, where patients and carers are sharing experiences, and also understanding to help increase shared decision making. This has perhaps become important and sort of pertinent for patients with long-standing conditions such as chronic kidney disease or CKD. So now looking at healthcare and drivers for change. So beyond healthcare, and drivers for change include: number one, greater need for focused services. Secondly, the need to embrace competitiveness and plurality of provision. Thirdly, a requirement to reprofile the workforce to make it better suited to tech and novel ways of working. Fourthly, the need for a definition of core data to develop a framework surrounding efficiency and effectiveness. Fifth, a recognition of sort of core services in relating to patient care, and leading to a requirement for sort of inclusive laboratory services, and part of integrated and part as part of integrated healthcare system or systems. And sixth, a need for sort of strong leadership. So now looking at aims and objectives. So to investigate perspectives relating to educational support surrounding CKD laboratory investigations and sort of the healthcare scientists healthcare scientists a role from a sample of the renal patient support group, the RPSG social media platform, and and where part of the as part of the aims and objectives, where the research team carried out five polls, looked to carry out five polls over 6 months to help understand healthcare communication techniques and importance of investigation from a laboratory medicine perspective. So now looking at sort of the now looking at the literature review, or looking at the literature review in as part of this as part of this overview. So over the past decade or so, the healthcare sciences profession has been advocating an expansion in the role of scientists from purely laboratory medicine or diagnostics to more sort of educational focus, providing understanding of laboratory investigations and impact. CKD patients often seek CKD patients often seek education and understanding of laboratory investigations to support recommendations surrounding disease pathway. Healthcare scientists have ability and capacity to extend knowledge base surrounding diagnostics to provide baseline education of laboratory investigations for patients with varying long-standing conditions or long-term conditions. There is evidence as to suggest that more health promotion in community can support the understanding of some of the complexities relating to laboratory investigations, health, and disease. In a mixed methodology investigation triangulated research approach, three academic institutions, for example, two health departments and two indigenous organizations collaborated to identify workforce capacity in remote communities surrounding education, and a need was found to educate the educators in the chronic care model and in using a population health approach. One of the challenges is ensuring clear clear definitions of providers' roles and expectations regarding shared care, defining roles and responsibilities will enhance the positive elements of collaborative interprofessional care and reduce misunderstandings regarding protocols, procedures, responsibilities, and authority. Now looking at sort of the methodology, so studies or investigations have used surveys or polls surveys or polls of healthcare service users, CKD patients, and the public. And these are investigations that also inspired sort of poll implementation through through the through and in through and in collaboration with the RPSG social media platform. So it had been decided between the team at the time to administer five short polls over 6 months uh, through through the RPSG social media platform, and the objectives of the polls were to help answer the following. to help answer the following. Where the first poll, was in around, would you see a physician other than your own? Secondly, how can healthcare professionals better understand or appreciate being in a chronic illness? Thirdly, what solutions are available through general practitioners, and transplant departments? Fourthly, if there was access to healthcare scientists in primary care, would you access this service? And fifth, how likely are you or would you use tech for educational support from a scientist? So the polls and implement in around polls and the implementation. So an initial version of the polls was piloted, and amendments were made to questions and phrasing. Potential respondents were informed of the understanding for the poll, of the poll or polls, the anonymity of responses, and ability to withdraw from the polls at any time. And the time frame for the collection of responses to the polls was limited to 6 months only. A sample size calculation was not carried out. However, instead, a target of 1,000 responses was set. So in around the analysis, 574 RPSG members at the time participated in completing polls, representing just under a 10% response rate. And the analysis is the analysis as follows. So number one, respondents informed that they would see a healthcare professional other than a physician, other than a physician, or other than their own, or other than a dedicated physician, as over where poll data informed around 50%. Secondly, when asked how healthcare professionals could better understand or appreciate being in a chronic illness, communication was the most important in around 33%. Thirdly, when CKD patients were asked if they had access to healthcare scientists in primary care, would they access this service? And the respondents polled yes in around 77%. Fourth, when asked if there was access to healthcare scientists in primary care, respondents responded to inform that a portal allowing access to medical records and laboratory results as laboratory results were as the highest in around 26%. And fifth, when asked how likely are you to use tech or technologies for educational support from a scientist, respondents polled high on access to remote healthcare scientists through a computer or a desktop app, so you can access so the service could be accessed so access can be gained from homes, from patients home from patients' homes. And so the and poll data was in around 33%, 33% in around poll 5. So now looking at sort of the implications to practice. So evidence indicates that healthcare professionals using again, using medical jargon without patient having knowledge in the first instance will continue to act as a barrier. Thus, targeting the attitudes and behavior of providers through potential solutions is important, so that the relationship between patient and the provider is balanced and smarter. The polls conducted have added value to an important topic, encasing scientists' involvement in provision of education surrounding laboratory investigations for patients for patients in CKD. What should happen over time are more patient-centric consultations, where patients have an understanding of laboratory investigations owing to the length of time in CKD. So, looking at the discussion, the aim should be to equip patients with education and knowledge base to ensure they have a sort of strong basis for shared decision making at all levels of care. Scientists who have trained to acquire variable skills across practice and across specialties, for example, could perhaps implement support for CKD patients in primary care. And this will bring a needed a healthcare professional asset into primary care. And social media organizations can and do allow for this, aligned to sort of tech sort of aligned to sort of aligned to sort of in synchronicity of in synchronicity of tech advances. So, online and e-clinics, for example, with healthcare scientists could be progressive, where healthcare scientists could be involved, providing basic understanding of laboratory investigations to prompt shared decision making. In conclusion, whilst tech and the exchange of a laboratory investigation through electronic patient records have the ability for health professionals and patients to share care, there can still be missed opportunities. Patients still require access to education surrounding laboratory investigations to ensure to ensure they get a best healthcare experience. Healthcare scientists are needed who are at the forefront surrounding CKD pathway. So, prospectively, healthcare scientists nationally could be playing sort of a broader role supporting education care for CKD patients surrounding investigations. So finally, on the as part of this overview, the reference or citation, and where the where in around this works, the when around this works, the full aspects of this overview are detailed in the peer-reviewed publication from 2020, in this reference and citation. And to also add, there was, as part of the methodology aspects of this works, the works had gone through and went through an ethics process before the works was before the team carried out the poll data works. So that draws this audio podcast to a close. This audio podcast is part of a research and presentation series or edition, and this audio podcast as part of a ZtormLabostix production. Thank you.